Good morning, students.
Good morning, sir.
Yes,
Good morning, sir.
yes,
Sir,
yes, Asha.
Good morning, sir.
Yes. Study of socialization. When we interact with others, learn with others, and learn about the groups and norms, maintain, conform our role in the groups. We had been learned that meaning, definition, types, important role, elements. Today, we have to start with types of socialization. According to Ian Robertson, first type, primary socialization, which is in primary group level, mainly early life, mainly childhood, in family, friends, playmates. Second, anticipatory socialization, learn own group culture and others. Then developmental socialization. The socialization mainly in adult already developed skilled progresses through new situations. For example, nursing graduates appointed as clinical nurse, develop their skills through workshop, seminar, which means developmental socialization. Then re-socialization, learn new skills. For example, we are nursing professionals. We have learned about the computer knowledge, for example, computer coding, so which is away from our subject. So that type of socialization is called re-socialization. Then general classification, there are two types: child, which is very useful for mold the personality of individuals. Then adult. The adult socialization is very important for growth, personal growth and development in the life. So it is continuous process, never end. Every day we have to socialize with our group members. Next concept is that organizational socialization. The organization which is in the organizational level, for example, educational organization, hospital as a organization, how they are socialized with each other, etc. Then agents of socialization. The examination, this question is very important. Agents, family and parents, school, socialization between children's among the students and between teachers and students. Then teachers, a student interact with teacher. Then playmates, peer group, friends, Peer group means same age group, classmates, Then religion. Go to church or mosque, interact with religious people and learn about moral teaching, moral ideas. Then literature and mass media. When you read a book, interact with books, learn knowledge. Then mass media, including TV, radio, nowadays internet, mobile phone. Then state, including law, rules, norms. The state make law, government make law for examinations. Next, elements of socialization. First, physical, psychological heritage. Second, environment. Third, culture. 4, norms. 5, attitudes. 6, role and performance. So these are all the elements involved in socialization. Then socialization and health. The question is that, is socialization affect health status of people? Yes. Affect or influence physical health. Lack of socialization cause stress and which cause to various physical illness and diseases such as mainly non-communicable diseases. Then communicable diseases due to the lack of immunity power. If lack of socialization cause the stress leads to all other diseases. Then mental health. As we know that various mental illness, the mental disorders due to lack of socialization. Next year, third year, you will be learning mental health nursing detail about. Then social well-being. Students, just think about it. When unable to interact with each other or any restrictions, difficult to learn with each other, what happened? Be difficult to happy in the social life. So good socialization promote social well-being. We can spontaneously and fluently interact with each other. Then socialization and nursing. The concept of socialization should be applied every aspect of nursing. First, care, client-oriented care. Next, cure, treatment. Students, we are nurses, should be prescribed. Socialization is a medicine. Any patient come into hospital with diseases or stress, what is the real medicine? The doctors may be right pharmacological medicine. That medicine only control. The effect is over, then stress will become or disease will become. The socialization is a sustainable medicine. For example, this is used to educate the people. For example, mental illness concern, depression. WHO says that one word, let's talk. This is a medicine for the depression. So socialization is a classic medicine. You can prescribe to everyone to talk with each other, and learn with each other to cure the disease, away from stress and promote happiness. Then prevention. So socialization used to prevent the communicable diseases, non-communicable disease. The reason is that good socialization promote mental development and physical development, and increasing the immunity power to prevent the disease. Then promotion of health, promote physical health, mental health, and social well-being. Then professional competence. We can learn with each nursing professionals, we can promote competitiveness between doctors, nurses, among the nurses. Six, nursing management. In hospital management, ward management, mainly in clinical concern, disease management. As we have discussed, you should be prescribed, it's a medicine, to reduce the intensity of disease. Then health education. Educate the individual, educate groups, families. Eighth one, stress management. Students, the socialization is a tool to prevent the stress and away from stress, cure the stress. Ninth one, counseling. Nurse as a counselor need to socialize with client, talk with each other, friendly talk, and experiencing to find their problems, which help us to client-oriented guidance. The nursing research. Every aspect of nursing research, this concept should be used. Students, this is one of the important research topic. INC, Indian Nursing Council, organize a research, the program. The many research scholars take this topic. For example, to study the socialization of particular institute. For example, our college, to study socialization in Thasiah College of Nursing. So it is a great research topic. We can study about this, what are the areas of difficulties, for example, among the teachers, socialization, among the students, socialization, and socialization between students and teachers. That research is to help to find the problems and improve this education in the education institutions. So this research, not only the education, as well as you can apply in hospitals and every setting. Then all nursing discipline use this knowledge, including maternal health. Every mother should be socialized. Students, socialization is very important for mothers. We know that in the time of motherhood, maximum of mothers are away from the normal society. They don't like to interact with even family members. They don't like to walk and talk with others. What will happen? the complication may be arise. So we are nursing professionals should be educated the mothers. In the motherhood should be happy, make happiness. No, not away from the normal life. Should be interact with each other, learn with each to promote happier motherhood. Then pediatric child health. Every child should be socialized. Lack of socialization cause various childhood mental health issues. Then medical surgical. We can use this knowledge to treat the diseases and reduce the intensity of disease. For example, in the time of surgery, to reduce the pain, less talk. Then mental health. As we had discussed, various personality disorder, mainly substance abuse due to lack of socialization. The stress-related problems, mainly depression. This socialization is a medicine. The various psychotherapies are available in mental health based on socialization. Then community health nursing. When you visit the community, identify the people interactions and emphasize the family members should be talk with each other to promote better health. Then difference between individualization and socialization. Individualization is a process of made independent. Socialization is only learning, how to learn. Let's talk with others, learn about groups and individuals, and adjust ourselves and maintain happier life. Second, individualization is develop good personality. We want to develop our own characters. But socialization shape personality. The time of individualization, we can explore our own talents. But in socialization, we can identify which place express particular talent, which place display particular behavior, shaping the personality. Third one, independently work in the group. Identify their groups and independently work their own job. Third one, interact with group members. So these all the difference. One more difference. Fourth one, regarding self, regarding social. Social means just interact, talk with. Then web of social relationship. What do you think about relationship, social relationship? Mutual influence the individuals and groups have on one another in their attempt to solve problems and in their striving towards goals. Keywords: mutual influence, attempt to solve problems. Then elements of social interaction. First element, social contact. Connect with each other. Then communication, share informations, communication. Then socialization in hospital and rehabilitation of patients. Students, we are nursing professionals, need to know about socialization in the hospital to promote happier work life. Define socialization in hospital. It's a process of learning in hospital. The healthcare professionals have been interact with each other, share knowledge, save life, and confirm the role in the hospital. So keywords: process of learning, hospital professionals, healthcare professionals, just interact, confirm role. Then persons involved in socialization in hospital: hospital administrators, managers, doctors, nurses, then allied health professionals. Allied health means, for example, physiotherapist, laboratory, etc. Then others, including patients, families, have been interact with, connect with. Look at this. It's a pictorial representation. These hospital professionals have been mutually interact with administrators, interact with each other. Then factors of socialization process in hospital. First factor, imitation. Students, this is one of the important factor. Male student nurses, act like staff nurse. Socialized with staff nurse, act like staff nurses. Then suggestion. The healthcare professionals mutually suggest with each other. Students, nurses, what are the suggestions give to doctors? Nurses, what are the suggestions give to doctors regarding patient history? Mainly vital signs. What are the vital signs? BP, temperature, pulse, yes, breathing, etc. Yes. So doctors depends upon this nursing suggestion, then only take decision which type of treatment is needed, then prescribe medicines, etc. Third one, identification. Identification means recognize ourselves and our client and colleagues in the hospitals. Then language. In hospital, language is key factor of socialization. Mainly healthcare professional maybe use standard English words, but when interact with client, need to assess the language of the patients. According to that, you need to take decision to and improve socialization in hospital. The importance of socialization in hospital. First, job satisfaction, which means happier work life. Then good healthcare outcome, save the life. Then hospital management, efficiently control the nursing services as well as other hospital services. Then improving organizational climate. What do you think about organizational climate as we have discussed? When we enter into hospital, we can see the professionals' faces, smiley faces, and kind talk, which is a cool environment in the hospital due to adequate socialization. Then reduce the stress among the healthcare professionals. Then effective communication between them. Then satisfying client needs. Then only we can identify the needs and diagnosis. Then socialization and rehabilitation setting, we will be learn next class. Now questioning time. Yes. Can you define socialization in hospitals? Ask me.
Limitation,
Which is factors? My question is that definition.
It is the process of learning in hospital and the healthcare professional.
Yes. Next keyword. Confirm their role, when we interact with among them and confirm what our role in the particular nursing unit or the hospital wards, So,
Administration,
yes, which is, what are the, which is members involved.
doctors,
Yes. Okay, excellent answer by Asmi. Thank you.
administration.
Yes. Thank you for answer. Asha George.
Yes, sir. Yes, sir.
Yes. Can you ask any question?
Yes, sir. Socialization and nursing professional competence.
Yes, professional competence means we can promote our competitiveness with other healthcare professionals. For example, when we interact with other people, we can promote our knowledge, So, who is best
Yes.
in the hospital setting or clinical setting? Okay, Asha George, excellent question. Thank you. Okay, students, thank you everyone. Have a wonderful day. Enjoy the day.
Thank you, sir.
Yes.